Hello, everybody, and welcome once more to my channel, Background Health. On today's episode, I'll be discussing the functions of a normal kidney. Every day we hear on the news about somebody, famous or unfamous, who has been diagnosed with kidney failure, and somebody who may either have received kidney transplant or undergoing dialysis. But before we go to kidney failure, I'd like to make sure we understand what a normal kidney does. And so, here are some of the functions of a normal human kidney. In the first place, the kidney is responsible for regulating the amount of volume of fluid in our body. If we have too much fluid, the body will eliminate the excess through the kidney by making us urinate more frequently. On the other hand, if we have less fluid or less volume than we're supposed to, such as in dehydration, the body will make us conserve fluid by making us urinate less. Next function of the kidney is waste elimination. While the gastrointestinal tract is responsible for solid waste elimination, the kidney is responsible for eliminating substances that are dissolved in blood, such as the byproduct of metabolism of proteins, which are excreted in the form of urea. Other substances that are dissolved in blood and subsequently eliminated in urine include medications. After our body have used medications and processed that, a lot of them are eliminated through the urine, dissolved. Now, this explains why sometimes when your kidney has failed or is failing, the doctor has to adjust the medication dose, often reversing the dose downwards. Failing to do this will cause you harm in the form of overdose or some other adverse effects or side effects. Another function of the kidney is control of your electrolytes. What do I mean by this? Potassium, for instance, when your kidney is failing, your potassium level goes up. And as the potassium level is going up, you can have sudden cardiac death, even in a matter of days. Other electrolytes that are regulated by the kidney include phosphorus. As your kidney fails, your phosphorus level goes up. With higher phosphorus, you begin to have hardening of a lot of tissues, it's different damages to your bone structure. Other electrolytes include magnesium. The levels are also controlled by the kidney. Another function of the kidney is regulation of your red blood cells. The kidney makes a hormone called erythropoietin, which sends signal to your bone marrow to make red blood cells. When your kidney fails, your erythropoietin level goes down, and your bone marrow do not get that appropriate signal, and therefore production of red blood cells goes down, and you have anemia. This explains why people who with kidney failure often require multiple transfusions. Next function is pH regulation. The pH of the body hovers somewhere between 7.35 to 7.45. That narrow range is very essential for regulation of a lot of body activities. At any given time, there are thousands of biochemical processes taking place in the human body. The enzymes, for instance, are active at any given time, even when we are sleeping. When the kidney fails, the blood becomes more acidic. In an acidic environment, a lot of those reactions do not function very well. At the same time, when the blood becomes acidic, other organs do not function well, including your heart, your muscles, for instance. So acidic pH of the blood is not good. The kidney, along with your lungs, are responsible for regulating the pH of your body. Next function is vitamin, specifically vitamin D. When your kidney fails, your level of vitamin D goes down. And that's because the kidney, along with your liver, are responsible for production of vitamin D. Vitamin D, on the other hand, assists in the absorption and regulation of your calcium level. So this is very, very important. This explains why many patients with kidney failure require vitamin D and calcium supplementation. Next function is blood pressure regulation. The kidney is very, very essential in regulating your blood pressure. In fact, many of the blood pressure medications are targeted to work on your kidney. This explains why when people have kidney failure, especially advanced kidney failure, the blood pressure can swing very high, sometimes very low. It becomes very difficult to manage. Now, another function is blood glucose. The kidney is very, very helpful in regulating the amount of glucose you have in your body. Sometimes people who have long-term diabetes, when their kidney fails, they find themselves needing less diabetic medicines. That's because of the role the kidney performs in regulating some of the medications that control glucose. So, essentially, these are the basic functions of your normal human kidney. A failure of the kidney will cause abnormality in all of those systems, which can therefore cause significant changes in how your body functions. Thank you until the next time when we discuss different types of kidney failure and how to regulate or prevent them. Thank you very much.